Good evening, everyone, and welcome to yet another special session on cancer care during COVID 19. I am Kamal Narayan, CEO of ISW Council, India's premier institution for health advocacy, awareness, and behavior change. With this show, we have been trying to bring authentic and useful information for effective cancer care from top experts during this ongoing pandemic. This is because they need extra care and attention due to their lowered immunity. However, today's session is about thyroid cancer. Yes, that tiny butterfly shaped gland that can also become the breeding ground of a disease as deadly as cancer. However, it is not very often that we hear about this disease. Thyroid is an important gland in the human body that produces hormones necessary for all the cells in our body to work normally. And it has a major role to play to regulate metabolism, growth, and development of the human body. So it is important to understand any disease that may affect this vital organ. To discuss this, we have with us today Professor Dr. C.S. Bal. Dr. Bal is head of Department of Nuclear Medicine at the All India Institute of Medical Sciences, AIIMS in New Delhi. He is one of the authoritative voices in the field of medicine and has often ruled the lack of infrastructure in India to handle rarer forms of cancers such as thyroid cancer. However, before we begin our conversation today with Dr. Bal, I would request our online viewers to keep sending their questions on the comment box, and we will try to answer most of them in the next 30 minutes. Also, like and comment with your feedback, and do share this special show on your wall to help many others who may also get benefited with this information. So, welcome, Dr. Bal, to this special show, and it's pleasure to have you on this occasion. Uh, Dr. Bal, so let me begin, by asking a simple question: what is this thyroid cancer, and who can develop it? And what are the warning signs or the symptoms of it?
Yeah,
Sir, your voice is not clear.
uh,
Yes,
now you can hear me properly.
yes, yes.
Yeah, thyroid gland is a very simple gland present in front of your windpipe and very easy to appreciate it. It is just in the neck and you can just below the Adam's apple. You can see this the prominent part is called Adam's apple. And just below there is a butterfly shape. There is two lobes, one on the right, one on the left, and they are connected by a small tissue called isthmus, and that is the important gland. And from the birth to death, we have different hormone requirement, and whole body works on the hormonal, chemical, and electrical. And the electrical head station is the brain, and the chemical station is also the brain. But how to get integrated? This is the hypothalamus, which is just below the thalamus. There is a small tiny part which connects the body's endocrine and neural system. Integrate. Suppose, like for example, you saw a snake. So the information went through your eyes, going to the brain. Brain interpreted there is a snake. So you quickly you decided whether you were to run or you were to take a stick and kill the snake. So all this is happening to run. You need hormones. You need energy to run. So that is taken care of by your hormones. And thyroid gland, and there are three hormones. We have plenty of hormones, but there are three hormones which are very important, which come with us and with us. That means they say from mother's womb to tomb is the requirement for these hormones. What are they? One is thyroid hormone because it affects all the cells of the body.
Dr. Bal, is your earphone plugged properly in the computer, because there is some disturbance coming on by the
Is it
side?
Is it okay or is it? I don't know what is
Yeah,
something.
now it is fine, sir. But maybe
Yeah.
it is not plugged properly or it is not tight enough. Just see that if it is. Yeah, it is fine. Please speak.
So,
Yes, sir.
uh, when you
No,
are
sir.
inside.
No, no, no. It's there is a disturbance. It is still. Sir, can you remove the earphone if it is possible? If it can work with your
It's very
computer.
old computer and it has doesn't have.
Okay, okay, okay. So just see that the jack is properly inserted, sir. Please.
Yeah. Can you see now?
Yeah, it's bit. Sir, please speak.
Is it okay now or no?
Yeah, better, 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 sir. Please, sir.
Okay, so this is how this is required, and then initial part of the life we need the hormone for the development of our brain, and subsequently the thyroid hormone maintains the energy metabolism of the body. It creates the heat in the body. Thyroid hormone has more problems than diabetes. You know, there are three hormones I told. One is thyroxine, another is insulin, the steroid hormones. They are metabolic hormones. They start to end. They will be always required. But why then diabetes people talk? All the endocrinologists talk about diabetes, not thyroid, because diabetes kills thyroid doesn't. Why the thyroid cancer kills less compared to other cancer? Because diabetes kills thyroid among, because thyroid cancer kills less compared to other cancers. Diabetes kills more thyroid cancer. But the most benign indolent cancer, the other one, it has the, oh, that is because the internet is unstable. Okay, that's the reason why it is not coming. Unfortunately, I'm using the institute system. So I was thinking to go home and do that. Then I thought, I'm in the working place, so I will continue from.
Yeah, there is little bit of disturbance, but I
Yeah,
think
yeah, because
just
that is on
to
internet system, public.
Just to Himani, is the voice coming properly from my side or it is my
So there's some disturbance there.
from my side or
Dr. Bal's side.
Okay.
okay? All right, doctor, sir. Let's continue. Maybe it gets fixed. Uh,
Okay.
so yes, sir. You were talking about that thyroid cancer kills less. That's why
Yeah, that's right.
lesser
In the
attention
thyroid
towards.
cancer, I've got just a paradox. It
Hmm,
has one side, we have got the most indolent cancer. In the
hmm,
other extreme, we have got anaplastic thyroid cancer, which is the deadliest cancer known to human being. Nobody survives more than a few weeks to few months.
okay.
So this is a spectrum, and 95 to 98% of the thyroid cancer will behave well.
Oh,
That's why where the medical oncologist, the radiation oncologist, they do not come into the action in thyroid cancer, because 95% of the to 97% of the thyroid cancer is managed by surgery and followed by radioactive iodine. Even if there is distant metastasis, the person is going to live for decades. It's not going to die like other cancer, where if there is a metastasis stage 4, the patient dies very soon. It's not like that. Thyroid cancer, though it is called cancer, but it behaves very well. The reason is that the thyroid gland, as well as the even the cancer thyroid cells, they concentrate radioactive iodine and they produce hormone. As the iodine is the raw material for thyroid hormone synthesis, what we do, we change the, instead of a cold iodine, we use a hot iodine or radioactive iodine. And radioactive iodine is like magic bullet. Wherever the cancer cell goes, it goes and hits to that cell and kills, not the chemotherapy. Suppose you give atromycin or doxorubicin or any anti-cancer drug. Most of the anti-cancer drug, they affect the dividing cells. They are so they affect all the cells. There is no specificity. Whereas iodine, where there is a thyroid cell, speaking of the iodine, you can understand the beauty. So the magic bullet in antibiotic, we called the antibiotics are called magic bullets. So
bullets.
in cancer, radioactive iodine is the which till date people are trying to use all sorts of therapy, personal therapy, diagnostic, all we are talking now was there since 1942. So what people, oncologists are now talking targeted or personalized treatment and mutation directed therapy was there. Thyroid cancer is there a model since 1942. No other cancer has been up to that quality. That
You,
is
you are saying that thyroid cancer always had targeted therapy,
since 1942. What the medical oncologists are talking now, we have been practicing for last 8 years.
okay. Okay.
Because this target, like you have seen in Mahabharata, Ashwatthama took out a piece of grass and put some and okay, go kill the unborn child of Uttara. So
Hmm.
that means it was the target. So now what is the warfare in the modern era is not carpet bombing, it is targeted. Suppose I want to TV tower. So I will send a missile which will cut the TV tower. I don't have to destroy the whole population, normal people. So the
Hmm.
modern warfare is again going to be
Yeah.
basically. So this targeted warfare is there since in the thyroid cancer 1942 onwards. That's why thyroid cancer has given the best result till date.
So, Dr. Bal, you are saying that almost 98% of thyroid cancer behave well, means there is not much of mortality involved in that. And
That is called differentiated thyroid cancer. 2% are called poorly differentiated or undifferentiated or anaplastic thyroid cancer, which is very deadly. Out of this 98% of thyroid cancer patient, there will be 10 to 15% of the patient which will have metastasis. Out of this metastasis, of them will concentrate iodine and 20% will not. So imagine 80% and 20%. So 20% up 80% is 6 or 7%, which iodine refractory thyroid cancer. That needs where we need the help of the modern targeted therapy, which is not as much, but prolongs the life, it gives a better quality of life, and all these will get all the, including like sorafenib and everything, improve the progression-free survival. But they have not improved the overall survival, except recently one study has shown that it has improved in elderly patients who are more than 55-year-old. But that's too, if you are 55-year-old, most of the anti-cancer drugs, they are very harsh on elderly people, you know that. So they are only, there is a little bit of improvement in the overall survival. So if you take 98% of the good cancer, 6 or 7% of them will be ultimately needing more treatment in form of medical or chemotherapeutics or targeted therapy.
sir, what is the prevalence of this cancer, and what are the who are at risk of thyroid cancer?
Yeah, thyroid cancer has got two type varieties. I told you the medullary variety and the differentiated variety or follicular variety. This medullary variety or parafollicular cells, they are 25% to 30% are familial. Like if the family member will be there, they will be, that is called multiple endocrine neoplasia type 2A, B, and NFMTs. Disposition, and there is a gene called ret gene, and if this ret gene is mutated, there is 99% chance that the children will, as per the Mendelian dominant law, 50% of the children will develop this disease. I have family members. There are 14 members of the family are suffering from medullary thyroid carcinoma type 2A. And type 2B is very aggressive, and most of the people, they die very young. There is a much less incidence of the 2B, but 2A is very popular because they get married, they pass on the gene to the next children, like that. Whereas thyroid cancer or the medullary thyroid carcinoma, which is sporadic, that has no relation to the family member. Anybody can have one family member. Then coming to the good quality called differentiated thyroid carcinoma, which constitute around 90%. Medullary thyroid carcinoma only 3 to 5. So the 90% of the thyroid cancer are differentiated thyroid cancer. They are very good thyroid cancer. There is no familial predisposition. In US, they say less than 5%, but in India, we have not. I have got more than 11,000 thyroid cancer patients on my follow-up, and I have only 7 or 8 family members who have suffered from thyroid cancer. Not so there are some brother, sister, mother, daughter, father, daughter, like that. We have got 7 pairs who have familial relation out of 11,000. So it is very, very negligible quantity.
Dr. Bal, your this seems to be very interesting aspect of cancer, and I think our audience will really get benefited by getting to know about these aspects. But somehow, no, your voice is not getting very clear for the people, and that my fear is that the audience may not get much benefited. So, may I request you, if we can do this show again sometime, maybe in the next week, if you can again give some
Yeah,
time,
yeah, sure, sure.
so that will help us. If you can, by that, that time you can
No,
connect
I
with.
can use my home line. I can use my dedicated line at home. That will be better. I am using the hospital line. That's why it is
Yeah,
creating.
so there is a disturbance. So I think somehow it may not create the impact which we desire to
Okay,
create.
okay, okay. So
So
can some other day, no problem.
yeah. So, sir, it was wonderful talking to you, but our discussion is pending, and
Okay,
I would request, my office will request you for our next, time for the next week or any day between whenever you
okay,
have
okay,
availability,
okay,
because I believe this information must reach to the people, but it
okay,
should reach enough manner that they can comprehend it also.
okay, 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 no problem. Okay, bye.
Thank you so much, sir. Thank
Okay,
you.
bye, bye.